we're back with Dr. Tyler Buckley with Cone Health Vascular and Vein Specialist. We're talking about vascular health. Cone Health has a new vascular lab that is opening soon. So let's talk about what that means for our community members and treatment for heart and vascular health.
Right, so that's a really big deal. One, all of us, myself and our vascular partners, as well as our cardiologists and cardiothoracic surgeons, are all going to be under one roof. So getting patients in to see different clinics or getting different testing should be a lot more streamlined, which we're all excited about.
Yeah, and that's, great for the patient too, because they don't have to go from one doctor's office to another, and all underneath one roof. That helps alleviate from frustration for sure. All right, what happens if vascular issues just simply go untreated?
So if they go untreated and, we have certain risk factors like uncontrolled blood pressure, uncontrolled diabetes, current smoking, it can lead to worsening of these plaques, which in each arterial bed causes a different problem. So in the heart, if you have coronary artery disease, that can lead to heart attacks or myocardial infarctions. In the carotid arteries, it can lead to strokes, and down in the legs, it can lead to pretty severe pain, can eventually lead to wounds, which potentially cause a patient to undergo an amputation.
Okay, so when you're talking all of these things, we're all like our eyes are getting bigger and bigger the more that you talk, because all of these are just such serious situations, and we're thinking to ourselves, a lot of times there's not symptoms, like you said, until it's too late. So what are some practical steps that we can do to help reduce our risk of any of this happening?
Right, so let me just clarify. It's not that it's too late, but it's the fact that you already have some plaque buildup once you start having symptoms, and there's no reversing that. The best way to prevent plaque buildup or worsening of these plaques is just controlling your risk factors. For most people, that's controlling their blood pressure if they have high blood pressure, controlling their cholesterol if they have high cholesterol, making sure their diabetes is under well control. But the biggest risk factor and the most important thing to do is to quit smoking if you're a smoker. That's been shown to be the #1 risk factor leading towards plaque in any artery, whether that's the coronary arteries that feed the heart, the carotids that feed the brain, or the legs.
And then people at home might be saying, all right, well, does lifestyle change really make that much difference for someone who's already been diagnosed?
It can make a huge difference. For example, if we talk about peripheral arterial disease, which is the leg arteries, if someone is in stage 1, which means their calves cramping when they walk, but they're not having terrible pain in their feet, they're not developing wounds, they're at a less than 1% chance of having worsening of their disease leading to amputation if they make the correct lifestyle changes. Now, if they don't quit smoking, if their other medical issues go uncontrolled, that can progress relatively quickly.
All right, and I think when we listen to the patient here from Eden who said everybody needs to pay attention to their body, a lot of times I think we let things that are happening in our body and we just go, oh, it's fine. I don't need to talk to the doctor about that.
Right, and I'm guilty of that too, I'll admit it. But there are times that things should be, should ring a bell, and things can be significant. One, if you ever have symptoms of a stroke or a mini stroke, that's not even calling your doctor, that's going immediately to the emergency room. If you're starting having some foot pain, some cramping when walking, that can be a discussion with your PCP about, do I have peripheral arterial disease leading to this problem, and what can I do about it?
All right, and finally, as we are kind of like wrapping things up, what's your best piece of advice for those of us when it comes to protecting our vascular health?
Absolutely quitting smoking if you're a smoker. That is the #1 risk factor. And then everything else is just managing your underlying conditions. So controlling your blood pressure, controlling your diabetes, controlling your cholesterol.
All right, well, Dr. Buckley, we thank you for your time and your expertise. And if you missed any of this, maybe you want to send it to a friend or a family member, it's going to be on our website in the To Your Well-Being section of our website. Thank you very much. We appreciate it. Right now, we're going to take a quick break, and our own meteorologist, Tim Buckley, is going to get us caught up on things.